Hello, everybody, and welcome today to our Let Us Turn Up the Beat HeartBeet Clinic Coffee and Chat. I'm here with Dr. Stephanie Hooker and Laura Ross, and we're so excited for you guys to present today on this amazing study. So, without further ado, I will pass it off to you.
So much, Abby. Well, it's a pleasure to be here. Thank you for joining us to learn more about the HeartBeet Clinic. Let us turn up the beat on the details of this lifestyle medicine pilot. We can turn to the next slide. So we know that when we talk about lifestyle changes, it's really more of a lifestyle than a diet when we talk about using food as medicine. And as Dr. Michael Greger said, who wrote the book How Not to Die, we should all be eating fruits and vegetables as if our lives depend on it, because they do. So I think in the past, we had done a really good job of telling people all the things they shouldn't do, but really embracing all the things we can do to change the trajectory on chronic disease. Next slide. So my name is Laura Ross. I have worked at Park Nicollet in cardiology for over 20 years and more recently became the director of the Park Nicollet Prevention and Lipid Clinic. And it's just been such an honor to be able to have so many tools to offer patients to improve their cardiovascular risk factors, from lifestyle medicine to medications to phase 3 clinical trials. We're really on the cutting edge here. And I have a little unique background that I'm a lifelong vegetarian, married to a hunter who worked on a cattle ranch in Wyoming for 3 summers with that cowboy twin brother, and was able to see how an all or nothing approach isn't possible for everyone, but also isn't necessary, that small changes can really lead to big improvements. I'll pass it off to Stephanie to introduce herself as well.
Hi, everyone. I'm Stephanie Hooker. I am a research investigator at HealthPartners Institute, and I am a clinical health psychologist by background, which means that I study the integration of mental and physical health. And in particular, I'm very interested in how to help people make healthy behavior changes and really how to help them make them stick to healthy behavior changes. And so that's how I got partnered with Laura, is that when she had started the HeartBeet Clinic, we realized we had a lot of shared interests, and we decided to pull our power together and make this a really great program.
Stephanie, I couldn't ask for a better partner in crime in tackling really chronic disease. So 80% of chronic disease is related to lifestyle. So this relates to cardiovascular disease, strokes, heart attacks, high blood pressure, diabetes, high cholesterol, smoking, alcohol misuse. These are all leading to chronic disease, not in days, but over years and decades. In fact, 133 million Americans have been diagnosed with a chronic disease. That's 3 in 5 adults, and $3.5 trillion are spent in treating these chronic disease. It's 90% of healthcare spending. So the novel concept is, let's get at it before it happens in prevention. And that's where we came up with the HeartBeet Clinic. Next slide, please. So when they did a huge meta-analysis globally, looking at hundreds of thousands of patients, they found that the leading risk factors, dietary risk factors for chronic disease, isn't just chips and hot dogs and hamburgers. It's really not enough fruits and vegetables, not enough nuts and seeds, not enough whole grains. That's things like oatmeal, brown rice, wild rice, barley, quinoa, frico, farro, the list goes on. Anything but white rice, our body will utilize as Mother Nature's sponge that just soaks up cholesterol and doesn't let your body reabsorb it. And so it's so good for the trillions of bacteria that live in our gut to kind of keep our blood sugar stable, our mood stable, to soak up that cholesterol and actually soak up toxins. Eating more fruits and vegetables and plants also lowers your risk of colorectal cancer. So there's so many benefits. So Stephanie was brave enough to join me on this journey to figure out, how can we tell people to just eat more plants? Not that it has to be huge changes, and help join to really figure out, how can we fine tune the HeartBeet Clinic, which we started in 2020 with just employees, the year of a pandemic, before the vaccine came out. So we started with a small amount of employees and really showed some significant improvements. And every year we kind of tweaked it and changed it with very limited funding. But thanks to a generous grant from Park Nicollet Foundation this year, we were able to employ a health coach, really enlist the help and resources of the HealthPartners Research Institute. And Stephanie and I kind of doubled down and got a control group versus kind of our intervention group that she's going to tell you more about as well. Next slide. So the basic premise of the HeartBeet Clinic is really following the 6 pillars of lifestyle medicine. So plant predominant eating, regular physical activity, 150 minutes of moderate activity where you could talk to someone while you're exercising, but you maybe couldn't sing a song. That would take a little too much breath support. Or at least 75 minutes of more vigorous activity where you couldn't talk to someone with your exercise. That's been proven to help reduce your risk of chronic disease, restorative sleep, stress management, avoidance of risky substances, and positive social connections. And then we had other workshops really looking at behavior change strategies, setting goals. How do you, when you walk in from work, turn towards your tennis shoes and go for a walk versus turn toward the couch and turn on Netflix. So our health coach was really instrumental in that. Next slide. So really the project aims, the primary objective was to really assess the accessibility and feasibility of delivering this HeartBeet clinic to patients. So the previous years, we'd only been able to utilize the resources through our wellness program at Park Nicollet and HealthPartners, but now we opened it up to patients with a number of different payers and insurances. And these are patients who had elevated cardiovascular risk. The secondary objective was really to look at changes in cardiovascular health. So the American Heart Association put out Life's Essential 8 score that Stephanie will dive in more deep into that. And then also we wanted to evaluate if additional pillars of lifestyle medicine, such as social connection, stress and sleep quality, and overall just quality of life improved with our intervention and also with the control group. Next slide.
All right, so I get to tell you about our study. So we conducted a pilot randomized feasibility trial, meaning that we were just trying to make sure that this study design that we had planned would actually work. So we recruited 60 participants, and these were mostly patients from the cardiology clinic. And many of them had seen Laura in the past and were really interested in being in HeartBeet. So patients who were interested had to complete a pre-assessment, which included surveys about their current behaviors, like their physical activity level, their sleep, their social connections, things like that. And then they also completed labs, which included their glucose and cholesterol. And then they had their vitals taken, meaning we collected their blood pressure and we measured their height and weight. And then after they completed this pre-assessment, we randomized people, meaning that by chance they were assigned to one of two groups. So the first group was a group coaching group, which is kind of traditionally how we've delivered the HeartBeet Clinic in past. So I will give you a little bit more details about what's included in each of these groups in a minute. The other group was a self-guided group. So this was an online program where people had all of the same information as the group coaching, but they just had less of a structure in how that was delivered. So we were really comparing, could we deliver this kind of more intensive group coaching compared to a less intensive online version of this program for patients. And then patients were in one of these interventions for 16 weeks. And then at the end of the intervention, we did the same assessment that we did at the beginning again. So we had them complete the same surveys, we had them do the same labs, and we measured their blood pressure and weight again. And the reason we did this is just to see if there over time, if the groups improved and if there were any differences in what they improved on over time. And our main questions, again, for this was, is the study design feasible? Would patients be willing to be randomized to one of these two groups? Would they complete these surveys at the beginning and the end? Would be able to collect the data? How fast could we get people into a study like this? What's the interest? So these are all questions we asked in order to demonstrate that we think this study design could happen if we were to do a larger study. And then the second question we had are the procedures and the interventions themselves acceptable to the participants? So participants, what did they think about the intervention or the programs that they got assigned to? And what was the feedback they would give us on those? And if there were any things we could do to improve, what would those things be? And similarly with the assessments, was it easy for them to do the surveys, or did they find them cumbersome? Things like that. So we registered our study on this online tracking system called clinicaltrials.gov. This is a government-run system that keeps track of any clinical trial that's happening. So anybody who's doing a clinical trial is required to pre-register their studies so that we know that what the study is intending to measure. So our study was registered on clinicaltrials.gov. And then we use this platform called Circle, which is an online, maybe I'll call it an app for people to host an intervention like this. It's often used for health coaches. And the nice thing about Circle is that it gave a space that was just be able to use for participants in our study. They had access to the materials and resources for the intervention. They could watch the videos. There was a discussion space so they could have a discussion with the other participants. And then for participants in the groups, they were able to log in and actually do their virtual group meeting through the Circle platform. So it was a nice program to be able to house the intervention. So let me tell you a little bit about how the two groups differ. So the group-based intervention, like I mentioned, this is kind of how we've always delivered HeartBeet. So we've made a few tweaks over the years, but essentially the first part of the intervention is that the participants meet in a group with our cardiology physician assistant, or Laura, essentially. And Laura just gives them the rundown of how lifestyle medicine works and what the ideas that we're trying to use in this program. What are the behaviors we're expecting people to think about changing? What are the labs and what do they mean? These are all, it's an opportunity for people to kind of come together, level set about what the program's about, and ask any questions as they're getting started. And then we kind of set them off. We give them a workbook, which includes a lot of information. It includes a meal plan, weekly information about the different lifestyle medicine pillars. And there was also an online course, which included videos for people to be able to watch to kind of give them more in-depth information about each pillar. And they were able to access all of that information through the Circle platform. And then each week, the groups had two meetings we asked them to attend. One was kind of more of a mandatory small group session where they met with a coach, our health coach, in a group about 6, 8, or 10 people, kind of varied a little bit, but that they would meet virtually kind of in a setting like this on Teams or Zoom, but it was through Circle, and they would have the opportunity to kind of work through the material together, ask questions, bounce ideas, and ultimately this was a source of support for people as they were making these lifestyle changes. The second meeting that they had every week was we considered more optional. If people couldn't make it, they could watch it later. But it was a virtual deep dive. So this was with an expert, somebody who knew a lot about that particular pillar of lifestyle medicine. For example, a physical therapist talking about physical activity, a psychologist talking about social connection, or a sleep medicine physician talking about sleep. So these were types of experts who could be available and ask even more in-depth questions from the group about that particular topic. On the alternating weeks, we had behavior change workshops that were led by our health coach that really gave them more skills about how do you integrate these behaviors into your life. So for example, they would be about goal setting or visioning, kind of thinking about what your long-term goal is and how do you get there, and other strategies that people might be able to use to help them kind of work through the process of behavior change. Because we know even if we tell people today that you should be doing more exercise or eating more vegetables, like it's a process. We don't expect people to go from 0 to 60 overnight. It takes time. And so sometimes having some of the added skills can help people really think about how to integrate these behaviors into their lives. So that was the group-based version. On the other side, our participants who got the self-guided online version had access to all the same materials on Circle. So they could read the same workbook, they had the online course with the videos, and all of that information was available for them to kind of work through at their own pace. We did give them kind of the schedule and said, we recommend that you use, about 2 weeks on each of these pillars and kind of what we should be doing each week. But again, it was self-guided, so they could do it at their own pace. They also had access to the online community via Circle. So our health coaches were monitoring the discussion, posting questions, encouraging people to engage with each other online. And then they also had weekly emails from our team to encourage engagement. So again, kind of reminding them about what the schedule is, what topic they're supposed to be working on, but it would help them get to that, get through the material at a timely way. And I'll let Laura kind of show a little bit more about what was in the workbook.
Yeah, so here are examples of a few pages. So week 2 is all about forks. So what should your plate look like? Half of it should be fruits and vegetables, a quarter of it a whole grain, and a quarter of it a lean protein. Could be beans or tofu or fish, or probably optimal. Egg whites have all the protein, none of the cholesterol, or poultry. Again, more plants versus focusing on all the things they shouldn't eat. And then dismissing some of the myths about, that all carbs are bad or all fat is bad. In fact, it's really the kind of food that you eat, and it doesn't have to get complicated into micro or macronutrients. Is just thinking about those complex carbs, pretty much anything that's not white, and the good fats from plants, in olive oil or avocados or nuts. Our body uses those a little bit differently, so they actually help lower cholesterol, which is fantastic. And then you'll see a snack list here on the other side of the slide. Just took some of my favorite snacks from my funny family, again with my husband who eats meat, lifelong vegetarian, and my 3 kids that are all the ways in between, and some of our favorite things like Lara bars you'll see a picture of. All of them have 6 or less ingredients that you can pronounce, so those are always a good go-to to have with you in the car if you're hungry, or when you're looking for something salty, looking to make sure that there's seeds and nuts in those crackers. You can see there's also like bear chips. They're just dried apples. That's the only ingredient, but they're the consistency of a potato chip. So if you're really feeling snacky, that's another really good option. So we tried to make it really applicable for the patients that they could turn around that day and start having some actions. We can turn to the next slide. So here's also some ideas from the workbook. So there was a 2-week menu plan with breakfast, lunch, and dinner, and a grocery list for all of the recipes for under $200 for 2 weeks to feed a family of about 5. Again, tried and true with my family, so people could pick and choose what they wanted to do. And sometimes when we talked about setting goals, it's like pick one new recipe to cook, this week, or one new recipe a week, and thought that made it more applicable. And then also just some ideas on the other side of things to really aim for when you're grocery shopping to make it a little bit easier. How are you going to get your protein and your omega-3s if you're trying to really narrow down on cutting out some of those animal products and swapping them with some plant products? You can turn the slide there.
All right. And so let me tell you, remember I told you about the study design. We had at the beginning and the end of the study, we had our participants with complete measures. And so that included surveys. So again, we assessed all of the lifestyle medicine pillars, and we at the end of the study, we asked them about their acceptability with our procedures. And we also measured their blood pressure and weight in the clinic. And then we had them get their labs done. So they got their fasting glucose as well as several measures of their cholesterol. And one of the main scores that we calculated from all of this data is called Life's Essential 8. This is a measure that was put out by the American Heart Association in 2022, and it's really trying to focus on prevention, right? So thinking about what are the things you should be doing now to prevent having a heart attack or a stroke later in your life. And then this is a score that's based on a 0 to 100 scale, where 100 is the best possible score that you can ever get. And it's based on these 8 pillars or 8 factors. So there's diet, physical activity, nicotine or tobacco exposure, your sleep health, body mass index, or your height to weight ratio, your cholesterol, blood glucose, and your blood pressure. And all of these, again, are scored on that 0 to 100 scale, but having a score of 80 or above is considered optimal. So that's kind of the threshold that we're trying to shoot for people, is having at least an 80 on all of these measures if possible. And so let me tell you about how the study went. So as I mentioned, we are shooting to recruit 60 people, and we were able to get 60 people within a month, actually. So we worked very hard, and we enrolled 60 people in about a month. Those participants were randomized to those 2 groups. So they half of them went to the group-based coaching, and half went to the self-paced online group. One person who got randomized to the coaching withdrew right away before they even started the intervention, and that was just because their schedule changed and they weren't able to actually follow through with the intervention. So 59 patients actually started in both of those groups. And we did lose a few on the way. We had a couple withdraw in each group, mainly again for personal things like their schedules changed, work things happened. And we did lose a few to follow up that we weren't able to get them back in to do their follow-up measures. So in the end, we had 23 people in our group and then 26 people in our self-paced group that completed our follow-up questionnaires. And so let me tell you about the results. This is the exciting part. So we had one of our main measures we were interested in is could we get people to move on any of these measures just as if they were out of range before, could they become in range or come in a healthy range after the intervention? And the great news is that in both groups, we saw that at least 80% of patients had improved at least one risk factor to a healthy range, which is fantastic. So they were out of range when they started and they moved to a healthy range. And that, was any one of these measures. So they had a blood pressure that was below kind of what we call hypertension or high blood pressure range. Their glucose went lower. They lost weight or their BMI dropped. They had their cholesterol, their total cholesterol went down or their good cholesterol went up. If they had their triglycerides, which is another measure of cholesterol, go down. And then their LDL, which is again, their like the bad cholesterol, go down. Or they increased physical activity. So if they made any improvements on any one of these, then they would consider like, yes, they meet that goal, which is great because we were doing what we call a multiple health behavior change intervention, which we were asking people to kind of do what out of these 6 pillars, make changes where you feel like you need to make changes. And so it's nice that, we saw changes in most people in both groups. And so this is that Life's Essential 8 score that I showed before. Remember, this is a score from 0 to 100. And so our target for people is really to get them above 80 if possible. At the beginning, both groups were kind of in the 60s. So they were below threshold where we would want them to be. And the great news is that in both groups, they actually got better to a very similar extent, and where the averages went up to the 70s in both groups. So fantastic results for us. Maybe a little bit surprising that both groups did equally well, but this was good news. We did see some differences when we kind of looked at each of those domains on the Life's Essential 8 about what improved for each group. So our group-based intervention group actually did much better in improving their diet. They started a little lower, so their score at the beginning was about 48, and they ended up at about 63. So you see actually quite a big improvement in diet in our group-based intervention. We didn't see that same improvement in our self-paced group. They're relatively the same, maybe a little bit lower at the end. Similarly, our group-based intervention group got better on sleep. We saw kind of a really nice improvement in sleep in the groups. The sleep stayed pretty much the same in our self-paced group. A little bit of a different pattern for these other behaviors. So physical activity was actually the thing that improved a lot more in our self-paced group, where they started again in the 60s and ended almost near 80. So on average, which was fantastic. So we saw a really nice improvement. And our physical activity in our group actually started very high, so already above 80. Hard to make a lot of improvements there, and they maintained it, which is great. Also, similarly, we didn't have a ton of tobacco exposure in either of these groups. Both of the groups were on average above 80, meaning we didn't have a lot of smokers or people who had tobacco exposure. But in our self-paced group, we did see that somebody who had exposure got better. So at the end, their average was 100, which was fantastic. We did see slightly better improvements in our cholesterol measures or lipid measures in our self-paced group, but there's an asterisk here because we do know that somebody in our self-paced group started a medication during the study. So we think that that might also obviously improve their lipids, but we did see some small improvements in at least in both groups. And there are really minimal changes in both our measures of glucose and body mass index, although there's, I would say, a lot of variability in the results here. We did have one patient who lost quite a bit of weight. So there was, again, it's maybe more individualized on who improved, but overall across the groups, they stayed pretty much the same. We did see that in our self-paced group, the stress level went down a pretty good amount, actually, whereas in our group-based intervention, it stayed about the same. And in both groups, we saw improvements in social connection and to a slightly greater extent in our group-based intervention, which we hope is related to the fact that they were in a group and participating in this together. So let Laura tell you a little bit about the acceptability and what we learned from that.
Yeah, Stephanie, what a great overview. And I just want to say, as a physician and assistant in over 20 years, there is no one medication that will get 80% of people to meet their goal or their target for these measures that we were looking at. And how many times I would see a patient once a year and say, remember to eat more plants and move more, and then a whole nother year would come by and we are both frustrated that it is a lot harder. These processes are very complicated, how to change habits and change these markers. So it's just so exciting on the clinician side, and then also just such a passion. So, and some of the feedback went along with that too. So many of our participants really just appreciated that cheerleader, not only in some of the group settings, but also from the coaches. You know, I liked the weekly emails. I liked the a place to be accountable, to get healthier, move more. Really powerful to see the numbers, you know, the weight and the blood pressure and the glucose and all the markers that we did to kind of see that there was improvement. And then also just helped change some eating habits and in keeping things just more stocked in the refrigerator. And then also having accessibility to the staff. So I think, you know, most of our grant went to pay our health coach. That's not something that insurance reimburses right now. And so how powerful to see that the group that didn't meet with a health coach had similar improvements. I think that was an unexpected surprise for sure, and leads us to, you know, what are we going to do next? So we can move to the next slide. And this is, all of these are my favorite slides, this one in particular, because to do a program like this, to get buy-in from my cardiology department, I have to show that we are not just not losing money, but oh my goodness, if we could show that we're making money, that is kind of the silver bullet here to get something like this on a bigger scale. So we bill $435 per visit when you do one-on-one visits. And working with our coding and compliance team, we're able to still bill that amount for providing the information in a group setting, as long as, you know, the clinician is taking time to go through the family history, address the other risk factors, you know, the lab results, all of those things. So we're able to bill that amount. Now, we had 21 unique insurance plans in those 29 patients. So even though someone might have Blue Cross Blue Shield or HealthPartners, they have a different plan under that. So we really, for the first time in the HeartBeet Clinic since 2020, we're really able to see how do other insurances look at group visits. And we were able to see on average, we reimbursed about $261 per person for those 4 group visits. So that was 625% more reimbursement for group visits in that same time frame that I could have seen for individual patients. And it saved my voice from saying the same thing over and over. So when you break down the numbers for group visits, we billed $12,615. And surprisingly, insurance doesn't give us all that we ask for all the time. They reimburse $7,579. If I would have used that same time in my clinic to just see 4 individual patients, which is how our practice is, you do one-on-one visits with your clinician, we would have billed $1,740 and been reimbursed $1,044. So this resulted in 16 and a half hours of clinician visit time and 25 appointment slots, which is almost a full week of patients for me since I work part-time. So I think the possibilities are really exciting and maybe a game changer for how we can deliver this important, effective, and efficient education and helping patients make the decisions on how to take health into their own hands as well, with coaching them along. Next slide, please. So in conclusion, we found that delivering the HeartBeet Clinic really in the group setting, which some patients really, it met all of their needs, and self-paced online format. For other participants in that group, it really helped and was effective as well. It was feasible, it was acceptable, and is associated with clinically significant improvements in their cardiovascular health and risk factors, as measured by a validated Life's Essential 8 score and by some of our lifestyle pillar surveys as well. And what we found is one format may be preferable to some patients versus others. So some of our self-paced participants, really thrived in that, and others were like, "Oh, I wish I had someone keeping me accountable. It's too easy to ignore those weekly emails, or I'm not logging onto the site," and vice versa. We heard from some of the participants that, gosh, getting to 2 sessions every week, in my small group, and then also the deep dive is just too much. I can't do it. And so, how can we work with some of that feedback? Stephanie and I have some ideas. We can move to the next slide. But first, what can you do now? So if you're interested in learning more about this, you certainly could make an appointment with the Park Nicollet Prevention Clinic to really talk more about lifestyle medicine one-on-one. We are formulating ways to deliver more group visits, but that's not quite ready for prime time yet. But there's always time to talk about lifestyle medicine. And also you can engage in healthy behaviors like we talked about, eating more plants, those whole grains, trying to get beans every day, trying to get at least a quarter cup of nuts and fish 2 days a week, moving your body to those parameters we talked about, and really prioritizing sleep. And then 3, stay tuned for future HeartBeet Clinic offerings. If you're interested, you certainly can send me an email at laura.ross@parknicollet.com. And we're kind of compiling a list of people who are interested in the next project. People in all of the HeartBeet clinics, some have raised their hands and say, "I can't wait to do it next." We've had several who've done it more than once, and been excited to be into the next program. So I'd be happy to hear from you if you would like to get an email when we have our next project going. We can move on to the next slide, please. Great. So what are our future directions? Getting some of that feedback, thinking about a stepped approach, which would financially be more considerate of our funds as well for some of those people, where we could make it more automatic to really limit this investment of staff time and health coaches. Maybe start with an automatic program, weekly group classes, or just an automatic, email that goes out kind of touching base, and offering resources. And then participants, if they find they're not successful, could opt in for coaching. Could we hold those monthly group visits and just have it on a rolling schedule so people can start every month? They don't have to wait for the time of year we're starting the HeartBeet Clinic, or how we've historically done it. And then also linking the program to some clinical decision support within our electronic medical record called Priority Wizard, to really identify and invite patients who might be eligible, who maybe their primary care doctor doesn't know that we're doing something like this over in the prevention clinic, that could reach out. And then really help us build a more comprehensive digital intervention that could really be maintained without all the intense staff involvement that past programs have involved. Could we learned from Circle. That was a great first rendition of this program, but could we invest in making it more applicable to our Health Partners and Park Nicollet patients? Stephanie, anything else you would add to that?
No, I think that is, all the different directions that we're thinking about, and that's the lovely thing about HeartBeet, is that there are so many things we could do. And I think this program is just a fantastic offering for our patients, and thinking about how do we make it available, more available to more people in a sustainable way, and make it work for everybody's different preferences.
Fantastic. And let's see, is there one more slide? I think that's it. Just to thank everybody. And I just can't thank Stephanie enough for her devotion, without any reimbursement, just her time in helping us crunch these numbers. And we're excited to put this into a paper and hopefully present at a conference about these cutting edge ways of care delivery that the Park Nicollet Foundation made possible. And for the cardiology department leadership as well, being really supportive of all of my crazy ideas and how to really help people eat more plants. Thanks so much.
Thank you both so much. This is such an incredible study to hear about, and just like the amazing impact that it had for the participants. And it was just so fun to be able to learn about your presentation today and all the hard work that you've done to help impact people's lives in a positive way. I do have a couple questions right off the bat. So with the 2 different models, so the group model and the self-paced model, for the group model, could you speak to the connections that people formed, if any, participating in this trial together?
Sure, I can jump in. So I think my favorite thing we did at the very end was a group cooking class for everybody. So we got to see the group visit people come and the self-directed group come, and those people who had really connected at least once a week in their small groups. I mean, the room was buzzing with, compared to our first group visits where nobody really knew each other. I saw people hugging because that was the first time that they had met and sharing stories. And, one particular participant who was on a medication for weight loss, but then layering lifestyle medicine on top of that for the first time shared with everybody that she had been able to bend over and tie her shoes for the first time since she can remember. And so everyone's clapping and so excited for her and the cheerleading that goes on. So that part was really exciting. And then the self paced group, when they saw these connections of people sitting next to them, they're like, can you please sign me up for that one next time? For some of them. And we know from feedback that people in the group visit were like, this was too much. Like, I would rather do a self-directed one next time. So we learned a lot, but I think, that's where we really thought the special sauce was going to be the health coach. But we found that isn't the perfect fit for everybody, and so that brings us the exciting possibility that we can work with maybe more of an automated, routine program with less staff involvement and still be really successful.
That's amazing because I think that like I can imagine like from hearing your guys' presentation and just your feedback just now, like you grow together, as a group and you in turn like form those bonds. So that's so cool. Thank you for sharing that. I also wanted to ask you, just of course, from a philanthropy perspective, how can philanthropy help support the future directions of the HeartBeet Clinic?
Yeah, I can jump in on that one. So, obviously the program costs some money for us to deliver. And Laura mentioned already, the biggest cost is our health coach. And that's not a expense that's reimbursable by insurance right now. Although I think it's fantastic. Everybody should have access to a health coach, right? Like, especially when people want to make these changes. So I think that's the biggest thing is like, if we wanted to create a sustainable program, we have to think about if a coach is going to be involved, how would that person be paid? And so, having some sort of philanthropy to get that started and to think about that would be fantastic. The other thing that Laura mentioned is that, we've used the Circle program and we actually think that maybe it'd be better to build our own platform that kind of just has the things that we need versus a lot of the bells and whistles we didn't really use with Circle. And that way we could make it more branded about, a Park Nicollet, HeartBeet Clinic, that sort of thing. So that's what another area that if somebody is like, hey, I would love to help contribute to that, that would be another thing. We're in the process of applying for federal funding as well. As many of you may know, there is some uncertainty about federal funding at this point. So advocacy for supporting research at the federal level is also helpful because I think the more we can study this program and show how it's effective and helps people, the more we can distribute it and to get it out there for other people to use.
Thank you so much for sharing that. And I had one last question I wanted to ask you, just out of curiosity. When you guys were talking about the Life's Essential 8 scores, what is the average score for Americans across the board? Or is there an average score, just out of curiosity, like for Americans or just in general?
Yeah, the average score for in a broad sample of nationally representative Americans, adults, is in the 60s. It's like 63, 65. It's not great. Where people tend to do worse is on diet. Actually, diet tends to be the lowest scored across the board, where that score tends to be closer to like 40s or 50s. And so we know that there is a lot of room for improvement in American diet. And so that will be I think that's partially why we really hit the plant-based eating very hard. Obviously there's also places that we know that people tend to struggle, like for physical activity. Only about a third of adults are meeting guidelines for physical activity. Sleep tends to be pretty variable too. So I think there's definitely room for improvement. And the great thing about Life's Essential 8 is all of these things are modifiable. Like, these are things that you can do and take action to improve improve, and that will reduce your risk of having a heart attack or a stroke in your life. So it's good to know your score. You can go to the American Heart Association website and you can actually get that calculated and figure out what your score is. And then you can think about how you might improve that.
That's a great overview. And I think people, think it has to be all or nothing, but you saw some big jumps in our Life's Essential 8 score by people just cutting down drinking to the weekend or, trying to incorporate 2 days of exercise. So it wasn't these huge changes they were waiting for life to slow down to incorporate. The average American, only 10% have the recommended fruits and vegetables a day. 10%. So 90% of us are not eating enough. Maybe not those on this call because you're tuning in for a reason, right? But there's a lot of room for improvement, and these small changes really do add up to preventing chronic disease down the road. So we're really thankful for the opportunity to be here, Abby. Were there any other questions?
Not at this time, but I just have to thank you guys again for taking the time to share about this amazing program. And also, it just one of the things from the Q&A and just the presentation that really stood out to me is that it makes improving your cardiovascular health feasible, approachable. It's not something that seems like insurmountable because, like you had said, the small changes can make such a big difference. So I just want to thank you both again for sharing your expertise, and I hope that you and everybody else on this call has a wonderful day.
Thank you so much.
Thank you.